Congratulations on the birth of your baby. You're headed home today, so let me go over some information with you. The first thing I want to talk about is pain management. You've been on scheduled pain medicine throughout your entire hospital stay, and I want you to stay on that same schedule when you go home. So 2 extra strength Tylenol every 8 hours and Motrin 600 milligrams every 6 hours. So I would encourage you to ask your nurse at discharge what time you took your last dose, and then set alarms on your phone, being sure to label it Tylenol and Motrin so there's no confusion. Stay on that pain management schedule as long as you need to. If it's 2 or 3 days, a week, 2 weeks, whatever it takes for you to be comfortable while you're healing. If the alarm goes off and you're feeling good, don't skip a dose, but that's how you know it's time to start spreading those doses a little further apart. When you're at the point where you're only taking pain medication when you feel something, remember Tylenol is good for incisional pain, Motrin is good for cramping. If they happen to fall due at the same time, they are safe to take together. Remember, Tylenol and acetaminophen are the exact same medication. Motrin, ibuprofen, and Advil are the exact same medication. Both are sold over the counter. You do not need a prescription for those. So, for your incision, I would also like you to take a picture of your incision today. That is your comparison photo. That way, if a few days from now you're concerned that something might be going on with your incision, you can take a second picture and you can put those photos side by side and you'll easily be able to spot any differences. So there are 5 reasons I would want you to call your OB office after you go home. The first one is heavy bleeding. If it's heavier than what you would consider a heavy period, passing a clot the size of an egg or bigger, saturating a pad in an hour. So the bleeding that you have after you have a baby has nothing to do with your period. It's actually where the placenta pulled away from the wall of the uterus. So that bleeding starts out bright red, then it goes to brown, then pink, and then clear cloudy as that wound is healing. If you're doing too much activity and stressing your body, that bleeding will get heavier. So that's why I want you to call the OB office just to make sure there isn't any other issues. The second reason I would want you to call is if there's any type of foul smelling odor. As a woman, we know our blood has a normal odor. If suddenly the bleeding on your pad has a foul smelling odor, yellow-green discharge, or an increase in pain, those could be signs of infection up inside the uterus. What we consider a fever is a temperature over 100.4 or higher. You would want to let the doctor know because that signifies there's an infection going on somewhere in your body. Any pain, redness, or swelling in the calf of your leg. If it feels like a Charlie horse or a muscle cramp, it could be a blood clot. And then a headache that doesn't go away with normal over-the-counter medication. So if you get a headache, you take your normal over-the-counter medication and it goes away, that's absolutely fine. It's the headache that doesn't go away with your normal medication, or it gets worse, or you start to have some visual disturbances like seeing spots or sparks or blurred vision. That's the headache I need you to call for. When you call the OB office, they are going to send you to the emergency room. That is standard practice. When you get to the emergency room and you're describing your symptoms, I want you to please remind them the date that you gave birth to your baby. That alerts them to the fact that they need to involve the OB doctor in your care right away, so that we can get you back into a room in the ER, get some magnesium therapy started, and get you admitted back up into the postpartum unit for continuing care. There are some other signs I want you to watch for postpartum preeclampsia. That headache is the most common symptom. However, there are others I also want you to be on the alert for. Pain under the right side of your rib cage, nausea and vomiting, swelling in your hands or face. Swelling in your feet and ankles is very normal after you have a baby. All the IV fluids we gave you for surgery, all the extra blood volume that you needed to support the pregnancy and grow the baby, your body is now working to get rid of that. Some of that is going to settle in your feet and ankles as your body is doing that job. But if you start to have swelling in your hands or face, you need to call the physician for that. Also, kind of to go along with that, would be gaining 5 pounds in a week. So in the next 6 weeks, as your body is processing everything from the birth of the baby, it would be an unusual time to actually gain weight. So I want you to call 911 or go to the emergency room if you have any type of chest pain, any shortness of breath or difficulty breathing, seizures, which would be a very late sign of preeclampsia, or thoughts of hurting yourself or others. A big thing I talk about in discharge is baby blues, postpartum depression, and postpartum psychosis. So baby blues is quite simply exhaustion. So it's very important during this next 6-week period that you take good care of yourself. You need to make sure that you are eating, that you are drinking, and getting enough rest, which can be a challenge with a newborn. So baby blues is quite simply exhaustion. If your partner notices that you are irritable, angry, acting differently than you normally act, they need to make sure that you're eating, drinking, and resting. It is absolutely fine to reach out to family and friends for help. You may need help with cleaning up the kitchen, doing dishes, laundry, vacuuming, picking up your grocery order, dropping off a meal, all those things. Because if you're breastfeeding or you're formula feeding a baby every 2 to 3 hours around the clock, that's really interrupting your sleep. So pretty much anytime the baby is sleeping, you need to try to lay down and take a nap. You may need to take 6 naps in order to get 8 hours of sleep in a 24-hour period. So self-care during this time is very important to help avoid the baby blues. But it's very common. I truly feel every woman goes through baby blues. Postpartum depression is different. That's related to the hormones of pregnancy. It has nothing to do with love, how much you love your partner, how much you love your baby. Love has absolutely nothing to do with this. It is 100% related to the hormones of pregnancy. So when you have a baby, when that placenta pulls away from the wall of the uterus, there's a big release of hormones. So right now your hormones are on a roller coaster. They are all over the place, and that is very normal. Over the next 6 weeks, as your body heals and recovers, ideally your body is supposed to level those hormones back off. But I heard a physician explain to a patient one time that in 50% of women that doesn't happen. So it's very common, but it's not something that women ever talk about. There seems to be a lot of shame and embarrassment that goes with that diagnosis. And I'm here to tell you, you don't need to be ashamed or embarrassed. It's a hormonal issue. It's nothing that you've done wrong. So the way to tell the difference between baby blues and postpartum depression, if you know you're resting, you're eating, you're taking good care of yourself, but it's not getting better, now it's time to reach out to your OB. They're going to give you an appointment. You'll come into the office. They're going to get you started on some medication. It may be some hormone therapy. It may be an antidepressant or an anti-anxiety medication. Every woman experiences different symptoms related to this, so there's a wide variety of medications that we can use. There are absolutely medications that are safe for breastfeeding, so please don't let that concern you as far as asking for some help. So when you get these medications, they are not a quick fix. They need to be taken exactly as prescribed for 2 to 3 weeks, depending on what the doctor tells you. And then I want you to call them back. And I want you to say, I'm feeling significantly better, I'm a little better, I'm the same, or I'm worse. And then they're going to make changes. So it can take a little bit of time to find the right medication or combination of medications to get your hormones back under control again. So please, please, please don't be embarrassed. Reach out to your OB. Now, I have some women that say, I'm already taking a medication for an antidepressant or an anti-anxiety med. That is correcting a hormone imbalance that you had prior to pregnancy. So it's probably going to have little to no effect on these hormones. Now, The reason I think there is such a stigma for the diagnosis of postpartum depression is what people see on TV and social media. So when you see the news stories of women who hurt themselves or unalive themselves or children, it automatically says that the woman had postpartum depression. That is incorrect. That is known as postpartum psychosis. It is very rare, very rare. However, one of the things I told you to go straight to the emergency room for is if you had any thoughts of harming yourself or others. That is something that we take very seriously, and we do want to get it treated immediately. I don't want you to call the doctor's office and wait a week or two for an appointment to get in. This is urgent. So I want you to present to the emergency room. I want you to let them know what's going on. They are going to get you back into a room. They are going to get in touch with the OB on call, get you started on some medication, but we are still dealing with the same hormones from postpartum depression, meaning the treatment is the same. Meaning those medications are going to take 2 to 3 weeks to start working. In the meantime, we're going to get you set up with a mental health professional to help you through this time frame and to keep you and your baby safe. What a lot of women fear and what they see in the medical drama TV shows, which are not real, is that the first thing we're going to do is call DCFS and take away your baby. We are not going to do that. That's punishing you for coming in and asking for help. And the perfect example that I give of this is if someone came in and said they were addicted to drugs and they were asking for help because they knew they were going to go through withdrawal, and the safest place to do that is in the hospital in case they needed medical treatment, that would be the same thing as us calling the police and having them arrested for using illegal drugs. Doesn't make sense at all. That just punishes this person who came in and asked for help. So we are not going to punish you. We are not going to call DCFS and take away your baby. We are going to get you the help you need. We are going to follow up with you to make sure that things are going well. So I want to make that very clear to everyone. Please, please, please reach out if you have questions on any of these 3 diagnoses. Be sure to talk to somebody. So for the next 2 weeks, no driving. With your incision, you may be on some stronger pain medicine. Your reaction time is going to be slower. I do want you as a passenger and when you become a driver again to make sure to wear your seatbelt down low where it goes. If the seatbelt should damage that incision in the event of a car accident, we can fix that. If you do not have your seatbelt on, we might not be able to fix that. So please remember to wear your seatbelt. In the next 6 weeks, you are going to have some appointments. So if you are going home on blood pressure medication, you will need to follow up with your physician within 48 to 72 hours to get back into the office for a blood pressure check. You will need a 2-week appointment for a mental health check-in, because we do want to check in with all of our patients to make sure everything is going okay and give you that opportunity to ask any questions or address any concerns that you might be having. And then your 6-week appointment is your return to work, normal activity, and talk about birth control. So the birth control that you choose, I want to make sure that you fully understand not only how it works, but potentially how it could fail. So please be sure and ask questions. Make sure that you fully understand how that works. So for incision care, I need you to only shower for the next 6 weeks. No tub baths. There is bacteria in your vagina that is normal, but in that bath water, it could get into your incision and cause an infection. That includes no swimming in pools, lakes, rivers, hot tubs, any of those kinds of things. So we want to keep that incision clean and dry. You're going to let the soapy water run over it when you get out of the shower, pat dry. Please, no ointments over the incision. No gel cover-ups out of kits. Keep that incision clean and dry. If you are concerned about scarring and you want to know what you can do to reduce scarring, at your 6-week appointment, please discuss it with your OB and they can make some recommendations for you at that time. Breastfeeding, we want the baby to eat 8 to 12 times in a 24-hour period. Formula feeding, we want to make sure that you are following the instructions on the type of formula that you get exactly. If you use the powder, please make sure to use distilled water and make sure the measurements are exact. Always read the instructions. When you're home, no new exercise routines. Casual walking is fine. No lifting anything heavier than the baby for the next 6 weeks. Nothing in your vagina. No tampons, no douching, no toys, no fingers, no penis. The concern for that is infection. Anything that is inserted into your vagina during this time could possibly introduce bacteria that could cause infection. If you have any further questions, please don't hesitate to reach out to your OB office. You can always talk to the OB nurse. After hours, all you have to do is dial the number that you would call the office to make an appointment. They will put you through to the answering service, who will then put you in contact with the on-call OB. The OB navigator will be doing a follow-up phone call to check in with you and the baby to see how things are going in the following weeks as well. Thank you so much for choosing our hospital. We appreciate your business. You'll be getting a survey in the mail, and we would love to hear back about your experience. You also have the opportunity to fill out WOW awards. You can ask your nurse about those if you have any questions. Congratulations and good luck.